Hi, I'm Becky. I'm the lymphedema advanced nurse practitioner at the Royal Stoke University Hospital in Stoke-on-Trent, and I'm a trustee of the British Lymphology Society. And I want to talk to you about your red legs. So I want to provide you with the ability to find out whether you have an infection or not, and what to do about it, and hopefully to make sure that you get to the right people first time. We know that it's very difficult to see if you have an infection or not if the legs are red, but often it means that people get too many antibiotics. So if you have redness, which affects both your legs below the knee only, they might feel warm and quite tender to touch, but you don't have a temperature, no hot or cold shivering, and you generally feel the same as you usually do, then your redness might be as a result of a chronic skin condition like eczema or psoriasis, or it might be because your veins are not working as well as they should do, what we call chronic venous or chronic vein insufficiency. And it doesn't matter how many antibiotics we give you, that won't make any difference. However, if you do have an infection, that will normally affect one leg or any part of the body, and it will be caused by bacteria in the skin and under the surface of the skin, which causes you to have a very high temperature and to feel very unwell, and it will be very, very painful. Usually feels quite hot. People will say it's like you could fry an egg on it, and the skin may be at risk of blistering. Blood tests can confirm the presence of an infection, but if you've got a break in the skin, maybe from a scratch or an insect bite or athlete's foot, then that could be how the infection got into the skin. And generally, this will require treatment, prompt treatment quickly with antibiotic therapy. For some people, that will be into the vein through a needle. It's very common to have this type of infection that we call cellulitis if you have swelling or swollen legs. And the British Lymphology Society has produced these guidelines, which can be really helpful to share with your GP or at the practice with the practice nurse or with your district nurse. So very easy to get hold of, free at www.thebls.com. So you may have red legs syndrome if both legs are red, painful, warm to touch with some skin changes, but you generally don't have a temperature and feel as well in yourself as you normally do. We know that it's miserable to have red legs. It's miserable to be in pain and have heightened sensitivity. So you don't want anything to touch the legs, and the skin's very fragile. You may feel a burning sensation. And if edema is present, then there can be a bursting sensation. And the risk is that fluid may leak through the skin. We call this lymphorrhea. The risk factors include increased age and frailty. If your veins are not working as well, if you're not moving around particularly well, if you have swelling, which we call lymphedema or chronic edema, if you're overweight, or if you already have something like eczema or psoriasis, these are all risk factors for red legs. The same website, www.thebls.com, has produced a red legs pathway with an easy to follow flow diagram, which covers when you have one leg that's red and when both legs are red. So it helps you to work through the flow diagram. It's designed primarily for healthcare practitioners, so GPs, nurses, and physiotherapists, other allied health professionals, but can be used to aid your thought process as to what's going on with your legs. And it has been endorsed by the Legs Matter campaign. And again, along with the Lindsay Leg Club, the Legs Matter campaign is a fantastic website, www.legsmatter.com, to find out more information. So what's causing your red legs? Well, it might be a condition called lipodermatosclerosis. This is where the lower aspect of the legs narrow and shrink in and draw in, which causes extreme pain, redness, heat, tenderness. One leg can start these skin changes first, but generally you don't feel unwell in yourself. You can get some staining on the surface of the skin, and there can be swelling, but generally it's a condition which is chronic, so longer term. Varicose eczema or vein eczema or gravitational dermatitis, which is caused by the leg veins not working as well as they could be. We get a reflux of fluid back into the tissues, which causes inflammation. And the skin gets red and hot, dry and scaly, although not everyone has that warmth. And you can have other signs of veins as well. So veins on the surface of the skin, there can be staining. And again, that narrowing that we spoke about, lipodermatous sclerosis, can also be present when there is varicose eczema. Contact dermatitis is where you have a reaction to something that your legs have come into contact with. So something that can cause skin irritation, redness, blistering, can be itchy and dry, and it causes this itch scratch cycle. So we scratch to relieve our itching, and then we can break the skin and be at risk of infection. So moisturizing is really important. And sometimes you have to be referred to a dermatologist to have patch testing to see which product you are sensitive to or have a reaction to. Fungal infections can cause redness. So athlete's foot is very contagious, causes itching, really lots of itching in between the toes or on the sole of your feet. And the red discoloration can start with the feet but can spread around the area. There can be blisters, and there can be white soggy skin or cracks between the toes. And if you've got large swollen legs with skin folds, or where skin rests on skin, for example in people who carry more weight, then this can be a fungal infection called Intertrigo. Heat can also cause redness, so from open fires, radiators, the sun. So really important to protect our skin and be aware of the damage that can be done to the skin from sources of redness. And it's much harder to recognize redness in darker pigmented skin. So it's really important, because you know your skin better than anyone, to seek medical attention and medical advice if you notice any changes in the skin at all. So what can you do? Well, you can talk to your healthcare professional, the pharmacist or your GP, using antihistamines to reduce itching if appropriate and you're able to take them. Use pain relief appropriately over the counter, or seeking advice if the pain is more significant. And also there are some medications which cause the legs to swell. So it's really important to discuss this with your GP or pharmacist to find out if you're taking anything that may be causing your legs to be swollen. Washing and drying the red affected areas daily, and then moisturizing. You may need a steroid cream. Again, this would have to be prescribed, so speaking to your pharmacist or GP or practice nurse. And then treating things like athlete's foot and preventing insect bites is really important. We use compression to manage red legs, so it's a really important part of management. And you may feel that you wouldn't want anything on your legs, or anything that may touch your legs might cause some discomfort. So you might shy away from this initially, but you should be assessed. You should undergo some tests to make sure that your circulation is adequate for you to have this treatment. So never self-prescribe compression. And then we would look at building up your tolerance over time if necessary. Try and remain as active as possible. If you're not very mobile, walk as much as you can using an appropriate walking aid, and then carry out foot or ankle exercises in sitting. So the NHS has chair-based exercises. If you have access to the internet and type into a search engine NHS chair-based exercises, you'll find some really good videos there. It's really important to go to bed at night and elevate those legs as much as possible to promote a return of blood and fluid from the tissues, and to allow the inflammation to settle. We understand that it may not always be comfortable to sit with the legs elevated, so taking the legs down from the elevated position and exercising in between really helps. And then healthy eating, maintaining a healthy body weight, losing weight if you know that you're carrying extra weight. You might need help with this from your GP or advanced nurse practitioner at the surgery for some support, but certainly This is really important. And your general practice will be able to manage a lot of symptoms of red legs, but sometimes referral on is necessary. Sometimes it may be that you need to see a dermatologist or a vein specialist. So the pathway that's been developed helps you and your healthcare professionals to find out what the cause of your redness is, with the overarching aim to improve your experience. Remember, you have the power. So if you have legs that are red, remember both legs, and it might be harder to see if your skin is darker, but you know your legs better. If you've tried antibiotics without success, so the redness has not been improved, and if you feel that you're not getting the help that you need, it's time for you to take charge. I hope this session's been useful. Thank you.